I want to welcome everyone. It's great to see so many people that I know and then other people that I don't know. We really appreciate you joining us for this educational session. It's something I don't know anything about, so I'm excited to learn. Um, I'm really happy to see a lot of people from other chapters as well as some non-CDS members. So thank you all for joining us. I'm excited to introduce you to tonight's speaker, Fenja Konigsmann. Fenja is a certified and licensed equine osteopath, and she brings extensive knowledge of equine bodies and systems, specifically four distinct systems, to get to the root cause of either a horse's lameness or health issues, and ultimately allowing the body to heal itself through manipulation and create homeostasis again through manual therapies. So Fenya, thank you for coming. We're really excited, and you can take it from here and then we'll recap at the end.
Awesome. Thank you very much, Vicky, and thank you for inviting me to speak about this. I absolutely adore osteopathy. I know it can be new to a lot of people, and where I'm from in Germany, it's like everyone knows what osteopathy is. Everyone has their osteopath, and it's not a very new modality. But here in the States, it's been interesting to come across very few people that have heard of it, but it's slowly starting to gain speed, which is nice. So with that, we're gonna jump in. We're gonna have a lot to go over. I'll be talking for about an hour. Let me get my presentation started. Okay, now I'm hoping that. Oops, give me just one sec. There we go. Okay, so we're talking about equine osteopathy tonight. Um, and that is a big subject. So we're going to be covering a couple things. I'm going to give a short introduction of who I am and how I got into horses and how I found osteopathy, and then we're going to dive into the meat of it and look at what osteopathy actually is. Um, I'm going to ask you guys to bear with me there because that can be a lot, especially if you've never heard of it before. But once we get through that part, we're going to go over what a session with me might look like, and then some actual real life case examples, and what osteopathy can help with, and a couple other things. So yeah, as I said before, I'm going to be talking for about an hour. And then at the end, as far as I understood, you guys will have questions, time for questions. Okay, so I already said I'm originally from Germany. I have now lived in the States for the past 5-ish years, and I'm based up here in Northern California, very, very close to the Oregon border. But my life with horses started really when I was 9 years old, and my mom gave me riding lessons for Christmas. And after that, I was pretty hooked and couldn't get away from them anymore. And for a long time, I just leased horses. And in 2014, I got my own mare that you can see on the picture on the left, Gatsy. And she moved with me to the States as well. So she lives here as well and made the big trip across the pond. So my mare was not a horse for a beginner. I was more or less a beginner, but I knew my way around the horse. I wanted to be a good dressage rider, potentially some jumping, but Gatsy was not an ideal first horse. She was 4.5 when I got her, and pretty quickly she showed a lot of behavioral issues, which I later found out were physical issues mostly. But she started bucking, she reared, she was unhappy, didn't want to move forward. We barely could do anything other than walk for a while. And aside from trying millions of different saddles, at least that's what it felt like, and a lot of different modalities. We tried acupuncture, chiropractic, vets, massage, and anything that I tried only helped temporarily. So eventually, okay, I was just kind of like, okay, we need to get to the bottom of this and figure out what actually is going on. So I brought her to a vet clinic, had her x-rayed from head to toe, and rode her in front of the vets, lunged her in front of the vets, and eventually the vets were like, well, we can see there's clearly something wrong, but we cannot tell you what. So I didn't get an answer there either. And then eventually I decided to try osteopathy. And back then, I was someone that was not very open to things that were out of the scope of Western medicine or allopathic medicine. I was very much, okay, I'm gonna look at a vet, and that's about where I want to stay. So even going to something like acupuncture was very out of the scope for me and not something that I felt super comfortable with. But then I tried my first osteopath because I didn't know what else to do anymore. And that was the first modality that actually created lasting change. Um, and eventually I stumbled upon an osteopath that I'd gone to the school that I then eventually went to. And I was blown away by what she was able to do for my mare and how happy she was in her body afterwards and how much more comfortable. So before I became an osteopath, I was actually going to be a teacher for English and biology at the University of Hamburg. And I went there for 4 semesters. And each semester I was like, yeah, I like this and I like teaching, but this is not quite my passion. And those kind of went hand in hand with what was happening with my mare. And eventually I decided to pursue osteopathy instead. So I graduated from the Vluggen Institute for Equine Osteopathy and Education. That institute has its main school in southern Germany, and then they had a branch in Texas, which has now moved to Florida. So I went to the Texas school actually, and I took a couple of modules in Germany, but most of it was in Texas. And that's a 4-year program, very, very intensive. And we end it with a practical and theoretical exam in front of an international board of the osteopathy registry that we have. And we also, to differentiate a little bit, we study European osteopathy, um, which is a little bit different in some ways to American osteopathy, but we'll get more into that at a later point. But before I started with osteopathy back in Germany, I was also certified in equine acupuncture and thermography. And now that I've been done with my osteopathy program for animals for a while, for canine and equine, I've also started another school to learn something that was very, very close to osteopathy for humans as well. So we're going to dive into what is osteopathy, and then I wanted to give a brief history as well. So the guy that you guys see on the right of that presentation of the PowerPoint, the person holding the human femur here, that is Andrew Taylor Still, and he is the founder of osteopathy. He founded it in 1874 officially. Before that, it was called the Still Cure. And he was a doctor, a physician himself, and was very focused on understanding and how the body functions versus just treating things with medicine or surgeries. He also lost quite a few children to, I believe it was meningitis, and that was partly what led him to want to focus on other things and not just medicine at the time that wasn't helping with the issues that he saw. So then later in 1939, William Gardner Sutherland developed the craniosacral osteopathy. At first, he was a student of Andrew Taylor Still's, and so he brought the craniosacral osteopathy really into what it is today. And he's the guy on the left picture here. So this person here is Sutherland. And then even later, in about 1985, John Pierre Barral, so that's the person in the middle, he developed the concept of visceral manipulation, so what we call visceral osteopathy. And then to bring all of that into the equine world, we have a couple of pioneers in that equine osteopathy world. And the person that first started applying osteopathy to horses was Dominique Genois. He was a French veterinarian, and he did that in the 1970s. And then Pascal Evrard and Yannick Vluggen, they both further developed and osteopathy into something that was more structured and safer. Unfortunately, both Dominique and Pascal have died, but Yannick Vluggen is still alive. So Yannick is the guy that's here on the left with the big skull. Pascal is the person here on the right, and then Dominique is the one in the right corner here. Um, and Yannick is also the person that founded the Vluggen Institute, and I was fortunate enough to have most of my modules with him. He's a very brilliant osteopath, and I'm glad I got to learn from him. But these three basically have made osteopathy or equine osteopathy into what it is today. So, what is osteopathy? So, osteopathy is a manual hands-on therapy, and ultimately what we're going to do is restore mobility and balance to the body. And it was translated from human osteopathy and then adapted to the anatomical and physiological needs of the horse. So basically all that to say, osteopathy is applicable to any body. It doesn't really matter who you have in front of you, four-legged, two-legged, whatever, as long as you know the anatomy. And that's also a big thing that I come across a lot, is a lot of people think that osteopathy is kind of this woo-woo, not quite like just a little weird modality, but really osteopathy is applied anatomy and physiology, and there's not much woo-woo about it. So we work with the entire body, and what we don't want is to just work with symptoms, because everything in the body is interconnected. So we work on four main systems, and the first one is the parietal system, which most people know as the musculoskeletal system. So those are your bones, your muscles, joints, tendons, etc. Then we work on the visceral system, which is a big one that sets us apart from a lot of other modalities. So that is all your inner organs and their connective tissue. And then we work on the craniosacral system, which is also a very, very important system. So that represents your connection between the skull and the sacrum with the dura mater that is around your spinal cord, and your cerebral spinal fluid, which is this fluid around your brain and spinal cord. And it's also really important for the pathways of the cranial nerves. So you have 12 main cranial nerves in the head. And what a lot of those do is give you your vision, your hearing, your taste, sensation, and more, of course. But basically, a lot of what we do in the craniosacral system is make sure that these nerves actually have the pathways that they need to function properly. And then the overarching umbrella that we work with is the fascial system. So that's all your connective tissue in the body. And you can kind of see on this picture below here, it is almost like a spider web throughout the entire body that connects everything. And we'll go deeper into that in a little bit. And we can talk about equine myofascial kinetic lines in horses as well. And if you guys want to go into that more, this book here on the right by Rike Schulz and Wiebke Elbrond and so on is a wonderful book to dive into that more. We're going to look at it more from a functional perspective, so we're not going to go over all these lines. But ultimately, the way we look at it is that these fascial systems, they connect the entire body. So how are they connected? When we look at the fascial system functionally from an osteopathic perspective, we can look at them kind of as pulley systems. So if you look at this hand-drawn picture on the right, I know there's a lot in there, but if you look at the orange line here that goes around the outside of the horse, and this is obviously 2D, so you have to think of this more in a 3D perspective, but that is what we would call the superficial fascial layer, or the parietal fascia, because it goes around your entire parietal fascia system, sorry. And this fascia connects on your mastoid process, which is if you look at these two pictures. So this is your horse's skull, and the mastoid process is about over here. So very far to the end. So on this close-up, you can see it a little better. So that's where the entirety of your parietal fascia attaches. Then we have our visceral fascia. So if you look at the pink line here, that goes through basically through the body around all of your inner organs. We call that the visceral fascia, or you can also call it the fascia media, so the medial fascia, basically. And that fascia connects at your hyoid. So your hyoid, also sometimes called your tongue bone, connects to the temporal bone, specifically to this little part here on the temporal bone. So again, we have the connection pretty close to the connection where that parietal fascia connects. And then we have another system, the craniosacral system or central nervous system fascia, which we could also call the fascia profunda or the deep fascia. And that is your green layer here. So that goes around your brain and spinal cord. And this one connects partly at your foramen magnum, which is basically the back of your head, but it also extends into the membranes that are around your brain. So some of those membranes, again, attach to this temporal bone here. So ultimately what we can see is all these three systems attached to this temporal bone. And you can also see the arrows that I drew into this picture, because all of these fascia layers, they act as pulley systems. So if we have anything going on in any of these places on the entire body of the horse, that's going to pull that entire system with it. And if we go deeper into it, all of these systems are connected to one another as well. So if we look at the um, top one here, the purple one that I drew in, that is basically your central tendon, but that's not super important at the moment. But it's the connection between your central nervous system fascia, so the green one here, and your pink one, so the visceral fascia, your organ fascia. And that connects and again makes a pulley system with your bowstring tendon that is on the bottom here, so the dark blue, that is the connection between your visceral fascia and your parietal fascia, so the pink and the orange. And again, that makes a pulley system. All this to say, I know this is a lot, but all this to say, all of these systems are interconnected. So anything that happens in any place in one part of the body is going to affect basically the entire body because they are all interconnected. So in summary, we talked about this, but the parietal fascia, so your superficial fascia, is connected to your mastoid process. So that was this bone over here. And your visceral fascia is connected to the hyoid, which we don't have in the picture, but would also be connected to this part of the temporal bone. And then your craniosacral fascia, your deep fascia, is connected to the occiput as well as to the membranes around the brain. So this other picture that I have on here, it's a human skull, but same idea. We have these membranes in the brain that you can see here in this bluish color, and that is your tentorium cerebelli and your falx cerebri and cerebelli. Right now, the tentorium is the one that I want to mention because the tentorium is the one that connects, again, this time from the inside to this part of the temporal bone. Okay. So I also wanted to briefly go into the importance of the organs because that is a big part of what we do and what we need to focus on as osteopaths, because 70 to 80% of the restrictions that you find in the parietal system are due to mobility restrictions of the organs. The reason for that being that each vertebral segment, so out of each vertebra, we have nerves running out of those from the main spinal cord to muscles, blood vessels, organs, etc. The ones we're going to look at most are the organs at this time. And I put a picture in here. Again, this is a human picture, but same deal on a horse, because that gives you a little bit of an idea of how or what nerves run to which organs. And we can see the sympathetic nervous system and the parasympathetic nervous system. So that's just to say that we have different systems in the body, the sympathetic nervous system being more your flight or fight system, and then your parasympathetic nervous system, more the rest and digest system. But the reason I bring this up will become more clear later in the presentation. But ultimately, as osteopaths, we need to know where these nerves run because the restrictions that we find in the parietal system are going to give us an indication of where that root cause might be coming from, or if it's not the root cause, where a more primary issue is. And then once we find the organ that might have a mobility restriction or another issue, then we need to figure out, okay, why is that organ in trouble? So we kind of follow it through the body to where it might have started or what might have happened. So then we do all this by adhering to a couple principles, and the main principles of osteopathy are the body is a unit, the structure and function are interrelated, the body is self-regulating and self-healing, and the arterial rule. And we're going to go over those just a little bit. So the body is a unit. We were kind of already talking about. That's the main thing we've been talking about. So everything is interconnected. There's nothing in the body that can be seen as separate from anything else in the body because oftentimes symptoms don't appear where the problem is. So a horse that is lame or a horse that is has a short stride on one hind limb, that hind limb might not be the problem, but the problem might be somewhere else, just showing itself in the parietal system. So the symptom doesn't equal the cause. So we have all of these cause and effect chains that can span across all those systems. And my job as an osteopath is to figure out where is that coming from and can we address that. Then we have structure and function are interrelated. What that means is any changes in function is going to change the structure over time and vice versa. So on this little picture here, you can kind of see we have a ball. The function of the ball is to roll. And if it rolls, the structure of the ball, a round ball, is going to stay the same. Now, if we start changing the function of this ball, so instead of rolling it, we're going to move it side to side, over time, that ball is going to change and it's basically going to have a shaved off aspect on the bottom of it. And that's ultimately going to affect your structure. And then they kind of go hand in hand. The changed structure is not going to let that structure function the way it used to function again. So if we relate that to a horse, if a horse has either anything structural, like some kind of trauma, some kind of accident where something has changed structurally, the function of that is going to change, and vice versa. So then the third principle we have is the vital force. And the vital force in other modalities can sometimes be called chi or anything like that. But ultimately, that is the inner driver of the body to self-heal, to self-regulate, to self-correct. So I'm guessing any of us, all of us have had like scratches on our bodies, especially if we're dealing with horses. Sometimes we'll have bruises, scratches, whatever, but they don't last very long and they go away pretty quickly in a normal circumstance. So that's your body's drive to self-correct and self-heal, and that is always going on in the body. And the driver of that is the vital force. And if you look at the picture here on the right, what we're striving for, what the body is striving for, is the homeostatic balance. So the blue circle that I drew here, that's kind of the representation of that balance. Because it's not just this one point in time that is the perfect body. No, it's more of a dynamic balance of, okay, sometimes we might be a little bit more in the sympathetic system. Sometimes we might be a little bit more in the parasympathetic system, but as long as we are in this circle, we are healthy and our body can respond to outside influences and still self-correct. The farther we go out of this circle, the harder it is going to be for the body on its own to come back into that circle, and that's where we often need help. So you can see things like arthritis or ulcers, Cushing's, things like that start to appear as symptoms that we then have to follow back through the body to see where did this start. And then one of the most important rules or principles is the arterial rule. And what that means is that any flow of any fluid in the body must be unobstructed. So that includes blood flow, lymph flow, cerebrospinal fluid, and they all must be unobstructed because any obstruction of that flow of fluid is going to, over time, lead to dis-ease. And that might first just be normal symptoms, and eventually that can lead to pathology. Pathology then would be out of my scope of practice because that is the veterinary world. So we try to come in before it becomes pathology. And if there is pathology, we can still help the body as long as we have the green light from a vet. So all that to say, uninterrupted flow of fluid is what we need for a fully healthy body. So that was a lot. That was kind of osteopathy in a nutshell, in a large nutshell, but that is the theory behind osteopathy. And the reason I still wanted all of that in there is because it's going to help you understand why we do what we do in a session, and yeah, how those things look. So a session with me, one of the first things we're going to do is go through a big questionnaire or anamnesis. Usually I send this to my clients beforehand to fill out so that we can know a little bit more about the case history, what's going on with your horse, when has it started, since when has it been going on, have there been ever any accidents, traumas, anything like that, injuries, surgeries, colics, you name it. How is the castration done if it's a gelding? How is the heat cycle if it's a mare? All of these things as an osteopath give me information to where I might start thinking that root cause potentially is. And it also gives me information of, are there any red flags? Are there any things that I would want to ask for an x-ray about? Or are there any things that if I work on this horse, I would cause more damage than good? Meaning, again, I would need the green flag from a vet if there's pathology like broken bones, ripped, torn tendons, things like that. Yeah, so lots of questions at the beginning, and then we go to actually testing the entire horse, and this means testing all of those systems. So we're going to test the parietal system, and that is a big system. So we're testing over 100 joints there, probably closer to like 140, I believe, is what I counted. That means we're going to test the mobility of all the joints, of all the limbs, of the spine, of the ribs, of the poll, of the face, well, the head, things like that. So all of that we have to test. And you can see me, for example, on this right picture here down here. I'm testing the mobility or part of the mobility of the poll. Here I'm testing the mobility of the sacrum and how it is sitting, or here of the hock, the TMJ. So really we need to test everything. And the sheet on the left, on the top left here, that is my personal evaluation sheet where I will then write down all of what I've found in your horse. So that would be me testing the parietal system, but I also have to test the visceral system. And here on this picture, you can see me, my right hand is more or less on the stomach here, and my left hand is on the liver. And when we're looking at organs, on a horse, it's a little more difficult to work on the organs because they have this gigantic rib cage. And most of, or all of your abdominal organs are underneath this rib cage. But if we sink into that layer of tissue, so to those organs, we can still check the mobility and the vitality of that organ, because those organs are also supposed to have specific motions that we are trained in, so we can know, if we know the normal, we can know the abnormal as well. So that's going to tell us, for example, if a stomach is supposed to move in this direction. I don't know, I'm probably a small little camera thing on your screen, but so I don't know if you can see me, but if the stomach is supposed to move, let's say, towards the withers, and now it's suddenly moving more up and down or more down, I know that axis of motion has changed, meaning there might be adhesion somewhere in that connective tissue around that organ. And then we also need to test the craniosacral system. So on the bottom left here, you can see me testing the temporal bones, for example, and I can test the temporal bones more on a mobility level, on a structural level, and I can test the temporal bones on a more fluidal level where we test basically we're listening to the tides of that fluid that is around your brain and spinal cord, because those tides, the amplitude and how strong it is, give us a lot of information about the vitality of the body. And here, for example, on this picture, I'm testing one of the joints of the craniosacral system as well. Sorry. Okay, so now I've tested the whole horse. I've tested the cranial nerves. So I've tested vision. I've tested how, like, does your horse have enough saliva? Does it have enough thin saliva, thick saliva, things like that? The hearing, the balance, all of that stuff that's cranial nerve related. So I've tested the entire horse. That gives me a map of the body. So we talked briefly about the importance of the organs and in relation to the restrictions that we find. So if there is a mobility issue in an organ, that means the nerves running to that organ, because they run in both directions. They run from the brain to the organ, and then they run from the organ back to the brain. So the ones that run from the organ back to the brain, we call them our sensoric branches, and they basically bring the information back to the brain, but they have to go through the spine first. And what they do in the spine, if that organ is in trouble, those nerves are basically going to be yelling and they're going to be really irritated and they're going to restrict the motion in that spinal segment. So when we test the spine, mainly what we're looking for is where are these restrictions located, because as you kind of saw on that little picture that I had earlier, specific sections of the spine correlate with specific organs. For example, if I have a horse that has had ulcers or still has ulcers or just has any kind of mobility restriction in their stomach, that is most likely going to show up right behind your withers where you have your TH 10 to 13 about. So we as osteopaths, we need to know those locations so we can then dive deeper into, okay, my stomach might be having mobility issues here. What's the reason for that? Where did that come from? What exactly is going on? So then we have to play Sherlock Holmes a little bit in that body. And once we have a plan of action that we formulate in our head, we go to normalizing the entire body as much as makes sense for that body at that time. So that, of course, depends on, is there any structural change already? How old is that body? So is it a 5-year-old horse that I'm working on, or is it a 25-year-old horse that I'm working on? That's going to change how much of the restrictions I'm going to normalize, because the older you get, the more structural change is permanent. And sometimes that body also needs those restrictions for stability, and taking it away would make it worse ultimately. So again, we're looking at all the systems here. So on this left top picture, I am normalizing one of the joints in the head that we'll go over a little bit later. And it's called the SSB. It's the joint between the occiput and the sphenoid, and I'll have a picture of that later so I can show you again. But that's in the craniosacral system. Or here I'm normalizing the stifle or the scapula over here, the ilium over here, so that's part of your pelvis, the sacrum on this one. So again, it really just depends, what did your horse show up with, what restrictions did I find, and what for this body at this time makes sense to mobilize. So once we're done with all of that, so we did the questionnaire, we did the testing, I did the testing, and we did the mobilizing of the horse. Then at the end, we talk about what I found. We talk about my suggestions for you, both potential supplemental suggestions as well as hands-on homework that's going to help integrate and stabilize and also keep mobile what we worked on in the session. Because while I believe 100% in osteopathy, it is not the magic fix. It is something that we all need to work on as a team. So I can't come in there as the magician and make everything better. It's more of um, it's a long-term solution for whole body health, basically. So it might take a few sessions to get to a really base level of health. And then ultimately, I don't want to see the horses all that much, depending on how much they are used, how much they travel, how much they have to do in their everyday life. Eventually, that might look like seeing them 2 to 3 times a year once we have that base level of health. So whatever we talked about during the session at the end, you will also get as a post-session PDF. And that's the homework that you can choose to do or not to do until I come again and we reevaluate. Okay, oops. So we're going to go over a couple case examples, and I don't know if we'll have time to go over all of them, but we'll just see how far we get. So those are just a couple of the cases. Don't need to really know all of them. But one of the ones that is huge and that we run across a lot as osteopaths is what we would call the typical grumpy mare. And as the owner, you guys know your horses best and know what their normal looks like and what their abnormal looks like. Or maybe you bought a horse that just in general always has seemed grumpy, always has seemed more sensitive. And with mares, they might be even more sensitive or even more grumpy during their heat cycle. Or maybe they don't even have a heat cycle, or they have too many heat cycles, so it seems like they're always in heat. And if this horse has been bred or not, maybe they can't be bred. They have had miscarriages, difficult pregnancy or birth, anything like that. And you would also see a lot of hind end issues, lower spine that is stiff and doesn't really want to move, potentially some swelling, lymphatic swelling in the lumbar spine. So again, your lower back, and a lot of other things, but those are kind of the main things. And osteopathically speaking, what I want to be looking at here, or the first couple of things that come into my mind, is what is going on with the pelvic rim organs of that mare. In this case, that would be the ovaries, the fallopian tubes, the uterus, the bladder. Those are my main considerations here, and I would have to figure out, are there any mobility restrictions in these organs that need to be potentially addressed? Or, and this is kind of, again, was it the chicken or the egg that was first? You have to figure out what was causing what, or did they develop together and they are basically keeping each other alive? So the heat cycle is, what's the word? Is basically the pituitary gland is the gland, the master hormone gland that regulates your heat cycle. And now we're going to come to that joint that I was talking about earlier. So if you look at this picture on the right here, and this light green area that I circled here, or that I traced here, is your occiput. And we're looking at the skull from the bottom side. So obviously the side that you cannot see on a horse that is alive. But this is the top part of the skull. So the mandible is taken off. And you can see the occiput here, that is part of your poll. So these condyles here, this is where your first cervical vertebra would attach, so your first neck vertebra. And then this dark purple one over here, this is your sphenoid. And then this joint here that is between that light green one and the dark purple one is what we call the SSB. It's basically a joint between the occiput and the sphenoid. And that is a majorly important joint for us in the craniosacral system that will also have an effect on all the other systems. One of the reasons for that being, if we go to this other picture over here, now again, this is a human skull, but it works the same way. It's just, it lays a little differently, but I couldn't find a good picture to show you this. So we have the sphenoid on the right side here and the occiput on the left side here. And that spheno-basilar junction is the joint I was talking about. But this little part here that is titled the sella turcica, the Turkish saddle, this is where your pituitary gland lives, meaning every mobility restriction of this bone and of this joint is going to have an effect on that pituitary gland, and could strain it. And that's not the only thing that could have an effect on it. Any kind of um, not loss of blood flow, obviously, you'd have a dead horse if you have complete loss of blood flow, but any kind of decrease in blood flow to that pituitary gland is also going to decrease the function of that gland. And if that gland is decreased in function, you're going to have the entire body affected. And on a grumpy mare, what might be affected most is that heat cycle, which could potentially lead to discomfort and the grumpiness and all of that stuff. But the mobility restrictions in and of itself, you can kind of think about, and again, if you can see me on the camera, you can kind of think about having on like a whole body fascial suit, which basically we're all running around with. And if we're on the outside here and I twist part of my shirt, and you guys do this yourselves, everything is going to be pulling towards that restriction, towards that mobility restriction, be it a scar or just a normal, quote unquote, normal adhesion. And that's kind of what can happen with the ovaries as well, for example, or the uterus or the fallopian tube. Anyway, ovaries as an example, because the ovaries in the heat cycle, be it human or horse, they are supposed to rotate to a certain extent. So during a cycle, they rotate, let's say they are supposed to rotate 100% back and forth, right? In best case scenario. So they'll rotate 100% during the cycle, but at the end of the cycle, they're supposed to rotate back. Now, if my hormones aren't working the way they're supposed to work, and they're not telling my cycle basically to work the way it's supposed to work, it could happen that it rotates one way 100% and maybe only rotates back 80%. And then the next cycle, it's going to rotate 100% back into the direction and then only rotate 70% back, and so on and so forth. But ultimately, what that's going to lead to is a twisted ovary, for example. So that's going to give you a restriction on those ovaries that is going to have effects on the entire body. So again, we look at the different systems. So we have to look at the fascial system. How's that connective tissue strain going to affect the other areas around that ovary? The ovary is directly connected by a ligament to the kidneys. So are we going to have kidneys that are under strain? So for example, if you see that area of the lower back that's slightly swollen, that could be lymph around the kidney, because the kidneys are more under strain. Or has the ovary, because it's now less mobile, has it pulled on the fallopian tubes that connect the ovary to the uterus, and is the uterus now sitting more to the right or more to the left, and is also has a mobility restriction. So those are all kinds of things, osteopathically thinking, that we have to assess and then address. And this is also sometimes where we have to and want to work with other practitioners. For example, on ovaries, fallopian tube, uterus, that is something where we'd have to get a vet involved and ask a vet to help us mobilize those pelvic rim organs. Okay, so we talked about it a little bit already, but that was what I just talked about. Those osteopathic considerations are what I'd first think about, but those things don't stay local because, again, the whole body is connected. So now we have to look at, okay, how are those things going to affect the rest of the body? If we go back to that innervation, so how those nerves run from the organs to the spine and vice versa, and to other areas as well, but the innervation of the ovaries, the fallopian tube, the uterus, all come from that lower lumbar spine, so from L1, 2, and 3. Meaning if I have problems in those organs, my lumbar spine is most likely going to be restricted. And that area of the lower thoracic spine, well, the end of the thoracic spine and the lower or the beginning of the lumbar spine, for example, also innervates the kidneys. again, the kidneys could have problems then, not just fascially, but also through the nerves that give them the information. Then also in that lumbar spine, you have the attachment of the diaphragm being this gigantic muscle that is really, really important for so many things, including your respiration. And once your diaphragm is under strain, your entire body is basically not under strain per se, but there's a whole cascade of events in the body that start happening if your diaphragm has issues. For example, oftentimes that diaphragm will then start to pull on that entire thoracic inlet and cause restrictions of your first ribs, of your lower cervical spine, things like this. And that's if we're looking more at the sympathetic innervation of things. And then we also have parasympathetic nerves that run from those organs to certain areas. In this case, those would be running to the SI joint. So that's the joint between your pelvis, between your ilium and your sacrum. And that can cause restrictions there. So again, you kind of can see everything is connected. You cannot look at one system without looking at the rest of the systems. And that's just one case. Okay, so now, especially nowadays, there are a lot of horses out there that have metabolic and endocrine disturbances going on. So potential symptoms that you might see are excess fat pads, like a crusty neck, abnormal weight gain or weight loss, and difficulty losing weight, overall bodily discomfort, difficulty shedding the coat in the winter or in the summer, for example, with Cushing's, decreased energy, decreased performance, and just things like that. So just overall decline in metabolic function. So osteopathically speaking, we have to go back to that pituitary gland because the pituitary gland, so that master hormone gland, doesn't only regulate that heat cycle, it regulates lots of other things. So I would be looking at that same joint again. So this SSB, this joint between the occiput and your sphenoid, because that is where your pituitary gland lives. So that is one of the biggest things I'm going to have to evaluate on a horse that has metabolic issues on the osteopathic side of things. With things like that, we also always have to take into account, and this is the case for all cases, but especially with these kind of things, we have to evaluate the feed, what are they getting fed, what is the horse's environment, what is their stress level in their life, and what might be causing these metabolic disturbances. And then we need to get to the bottom of that. Okay, so that was a little shorter because we already looked at the pituitary gland. Now, if we go to geldings, which there obviously are a lot of them out there, they oftentimes have restrictions in their inguinal rings. So what that means is when a gelding gets castrated or a stallion gets castrated, what gets cut off are the testicles, right? But we have things that are running to the testicles, like nerves, blood vessels, lymph vessels, things like that. And of course, we're also cutting through connective tissue. And that connective tissue, again, has nerves that are going to react. So once that those structures are cut through, that can lead to a bunch of symptoms that eventually you as the owner can see again. So for example, intermittent or unexplained hind end lamenesses, difficulty taking canter leads, cross-firing, just having no propulsion or cannot collect or take weight on the hind end, stifle problems because the fascia coming from those inguinal rings is directly connected to the stifle. Difficulty lifting legs to the side, which we also like to call the pee on the tree test, that a lot of geldings will not be able to do. Short striding in general, a tight lumbar region. This is again going to be due to those nerves because on a male horse, we're going to have not the ovaries, of course, that are innervated from that area, but now it's going to be your testicles, your semen cord, your prostate, and your bladder again. That is innervated from that L1 to 4. So now if we have issues in that area, that's going to give us restrictions in the lumbar spine. And then just general reluctance to move forward or bucking, things like that. So osteopathically, I kind of already talked about it. We're cutting through a bunch of structures that have nerves, and these nerves are our information pathways. They're the highways that are bringing whatever's happening somewhere in the body back to inform the brain ultimately. But on the way there, it has like train stations until it gets to the main central station, basically. So, and at these train stations, it's going to cause irritation or just give information to those train stations as well that will cause different things at different points in your body. So those severed nerves are going to give us a low level irritation, meaning they're always going to be kind of yelling at that lumbar spine, which will give you restrictions in that area. And then I briefly mentioned it, the fascial strain. So those inguinal rings are partly made out of the internal and external abdominal oblique. And they don't make like a round ring, but those overlapping structures make this fold almost, where those blood vessels, the semen cord, lymph vessels and nerves run through. And when they are castrated, the cremaster muscle, for example, it kind of snaps back because it contracts. So that ultimately can cause those restrictions in those inguinal rings. And then we have fascia that runs from that inguinal ring to your pubic symphysis, for example, so to your pelvis, but also to your stifle. So a lot of geldings have stifles that are in trouble as well. And then the gelding scar itself, so the outside part that we feel, is also going to have lower vascularity, so not as much blood flow. Scars are not as mobile as other tissue and can also cause strain on the other areas. Because you can think about that fascial suit again. If we have a scar here and it's not as mobile as everything else, most of the things around it will pull towards that more immobile part of the body. Let's see what the time says. Okay, I think we'll go over one more. Um, let's see. I don't know if you guys have a preference. I don't know if I have access to the chat, but I can go over stomach issues or head shaker. If you guys want to choose one, I'm happy to do one more because I think we're running out of time.
I think more people have stomach issues. We've got a lot of show horses. We've got a lot of horses, they're on ulcer guard, and now, all the other feed supplements that are helping. So maybe stomach issues is a good place to end.
Perfect. Then let's do that. Okay, so stomach issues. So that's going to give you horses, with or horses that potentially are cinchy when you tack up, or just generally don't like to be tacked up or touched, especially in that stomach area, so that left side of the horse. They might have recurring ulcers that just don't want to go away. They might be picky eaters or stress eaters. They can't lift in the thorax, or in the withers. They are reluctant to bend, especially to one side. Sometimes they might have colicky behavior, and they're generally just irritable. Um, so osteopathically speaking, if we look at those organs and what those restrictions or which restrictions those will cause, in this case, it would be right behind your withers, kind of the TH or the thoracic vertebra 10 to 13, because those nerves are the ones that run to the stomach. So the stomach also lies directly against that diaphragm, so that big muscle. So any kind of stomach issues, mobility-wise or otherwise, are going to cause diaphragm strain as well. And like I said before, if we have the diaphragm involved, the entire body is involved. So we also have to look at the mouth here, very, very important, because any kind of digestive issues or stomach issues, or the digestion, what I'm trying to say is the digestion starts in the mouth. What that means is from the cranial nerves that have to be checked. So for example, you have a cranial nerve 7 and a cranial nerve 9, that's your glossopharyngeal and your intermediofacial. Those, aside from other functions that they have, but they are responsible for saliva, so the thick and the thin saliva. The thin saliva is there for enzymes to start breaking down the feed in the mouth, and the thick saliva creates that slime around what they call the bolus at the end, so that that ball of food that then gets um, put down the esophagus, and it needs to be sufficiently slimy to really get to the stomach. And then the stomach needs to have enough stomach acid, and the stomach starts producing stomach acid once the horse starts chewing in a certain way. So the chewing has to be correct because that's going to activate certain nerves that then tell the stomach to produce gastrin, things like that. So again, it's a whole cascade of things that needs to start correctly and function correctly so that that whole chain of events can function properly. So if I already have problems in the mouth, so the balance of the teeth, for example, or the TMJ mobility, so your jaw joint mobility, or your poll, which is also going to affect the mobility of your jaw, that's already going to have potential repercussions on the stomach. And then with stomach horses or horses with stomach issues, a lot of the times we have to look at the stress level of the horse. So how much do they travel? Do they go to a lot of competitions? Do they have a healthy balance, a base level of health that they can cope with the stress that is put on them? How do they live? Do they have like do they go out to pasture? Are they only in their stalls? Like, and what is being fed, of course? Are they being fed things with molasses and sugar that is going to be stress or just inflammatory to that body? So there's a lot to consider with stomach issues, and that can be a long road to get to a place where they won't react like that anymore. And ultimately, things like Gastrogard, a lot of my clients say, well, it helps for a little bit and then it doesn't help anymore. And they feel like they need to stay on that Gastrogard basically forever to keep it somewhat in check or put the horse on it again and again and again. But it's not a long-term solution. It's a symptomatic fix to something that has a deeper problem. So that's going to be slightly different from horse to horse. So that's, yeah, something or some things to consider osteopathically. And then of course, if my digestion or if the stomach already has issues, meaning potentially it's not digesting, doing its part of the digestive process enough, then my small intestines and my large intestines have to make up or have to try to make up for the fact that the stomach is not doing what it's supposed to do or can't do what it's supposed to do. So that's going to have an overworked small intestine and an overworked large intestine doing things that that's not their job basically, or their main job. So that can also cause strain on the rest of the digestive system. And then if we look at the rest of the systems, well, I already said the diaphragm is going to be involved, so that can give you involvement of really the entire body again, from your sacrum, so from your pelvis all the way to your pole. Okay, so we're going to skip this one, but if we just touch on it real quick, head shaking is often due to the trigeminal nerve, which on this picture on the right here, most of these nerves, not all of them, because it shows more than the trigeminal nerve, but the trigeminal nerve is huge and has lots and lots of branches. So we're going to have to look at all of those pathways of that nerve to make sure it is not being restricted or irritated somewhere. So that's all I'm going to say about that one. And then what I like to bring to the table as well is looking at osteopathy and using it for prehab versus rehab. So a lot of people, including myself, when I first came to osteopathy, it was kind of the last ditch effort, the thing that, okay, I tried everything else, now we're going to try osteopathy. It works great as rehab, but a lot of these issues, they take years to develop. So they're also going to take years to come back to a really healthy body and recover from whatever was happening, be it an actual trauma, so an actual accident or injury, or like something like stomach issues, ulcers, things like that. So it's just going to take basically as much time, not as much time, that's not true, but it's going to take time. That's what I want to say there. So it's wonderful as rehab, but we might have to work with other practitioners. We might have to just really keep at it. And the clients also really have to do their part of the homework to get that horse healthy again. I prefer using osteopathy as prehab, which is very rare to be able to do that. Um, but ultimately, what we're doing is giving that body as much adaptation possibilities as possible, meaning we're giving it as much health as we possibly can and making that circle of health that you guys saw on the picture many slides ago, making it more stable ultimately and decreasing the um, potential of injury, really, because you have a better and healthier balance in the body that's going to optimize performance and comfort, but also catch issues before they even escalate into worse things. Then we talked about a lot of symptoms already, so this is just a little summary of when to call an osteopath, and this would be usually in the rehab part of things. But any kind of unexplained behavioral changes, any kind of sudden performance issues, even if they're subtle, any cross-firing, difficulty picking up leads, bending, flexing, any resistance to work, either under saddle or ground work, grumpiness, just all that stuff that we already talked about are things that, as an osteopath, we can try and find that root cause and see if we can figure out a game plan to make that horse feel more comfortable again. Then I also often get asked, what is the difference between osteopathy and other modalities? And I put this at the very, or at almost the very end of the presentation because we went over a lot of stuff and explained what osteopathy is. And as I said before, one of the biggest things that sets us apart is that we look at the visceral system, or rather that we look at all the systems in general, but the organs have a huge role. And most other body, like whole body, most other body work modalities, what I'm trying to say, mostly focus on one system or mostly like play into one system. So be it massage, chiropractic, structural integration, so fascial work, craniosacral therapy, which again only looks at one system. So most of these things focus on one of these systems, and osteopathy is more focused on all of these systems together so we can find the root cause. That doesn't mean that these other modalities don't do good. There are brilliant practitioners of all of those modalities out there that absolutely can help horses and are helping horses. That's just kind of the difference between what we do and what a lot of other modalities focus on. Okay, I know that was a whole lot for everyone probably, but thank you guys all for listening. I hope that gave you a fairly good idea of what osteopathy is, and I know it's different to see it live versus in pictures and with me talking to you for an hour. But I hope that wasn't too much and made sense. And if not, you guys now, I think, have 15 minutes for questions, I believe, but I'm gonna give that back to Vicky. So yeah, but here's just another slide to how to contact me. Yeah.
Perfect. Yeah, thank you so much. That was really well presented and gives us a very clear view on what it is you do and why and how. So I think we do have one question so far from Heather. She wants to know, would it make sense to have a wellness assessment on my seemingly healthy horse?
That kind of brings me back to that prehab versus rehab. I would say absolutely. Oftentimes, even if they seem healthy, again, that goes back to keeping them healthy in the long run. So if this is a younger horse, or even if it's an older horse, maybe there are things going on that aren't being shown as symptoms yet in that horse's everyday life that eventually are going to lead to symptoms. But as an osteopath, or rather the body itself, has this intelligence of it's going to show you what's going on. So if there's even an underlying issue with the liver or with the kidneys or you name it, the stomach, since we talked about it, that's going to show up in the body and as restrictions um, that might not have gone as far as going into adaptations or compensations where the body starts showing symptoms.
Mhm.
Um, I hope that makes sense.
Yeah. Yeah. So when you come out and say you on a prehab side of it, what would be a normal maintenance schedule on prehab, and then what would be a normal maintenance schedule on rehab? And I'm sure that depends on what it is your findings are. But
Yeah.
can you talk to us about that a little bit?
Yes. Generally speaking, that's really hard to answer because it's gonna depend on the individual body, even with prehab. But ultimately, my goal would be to see them 2 to 3 times a year, especially if they're being used as a like dressage horse, jumping horse, you name it. Like if they're being ridden 4 to 5 times a week or more, then just keeping that maintenance at 2 to 3 times a year, I think is really good. So if this is a prehab situation and this horse has a really good, healthy balance, then that's what I would go with. If this horse is already presenting with issues, normally what I would say is at the beginning, I would want to see them every 6-ish weeks and see if that track that we took, so if the suggestions I'm giving, if the things we've potentially changed in feed and supplementation and training are working, um, then eventually that gap between sessions gets bigger and bigger and bigger. So that could be 2 sessions, it could also be 5 sessions. It really depends on the severity of the case and what we need to address and what in that uh, horse's body, but also in the environment, is making those things come back. So we got to eliminate the root cause to be able to um, ultimately create a healthier balance.
Mhm. I would suspect there are a lot of our people who use chiropractors, they use body workers regularly and all of that. And I know when you and I were talking before, you talked about the fact that you collaborate very much with all of those people as well. Like you know, you're not trying to kick any of those people off the case. As you know, it's a collaborative approach. So if that's the case, would you want when you come to look at a horse first time, or even multiple times, you want the feedback from those other workers, right? The chiropractor, the body worker, the shoer, any of those kinds of people that are part of the team. Um, is that something you would require upfront, as well as, like you said, you know, you would want to see x-rays or talk with a vet if it was a kind of a critical situation in a tendon tear or a bone break. But would you want to see and hear the updates from those other folks when you came back to look at the horse again?
So I wouldn't say it's a requirement. The only requirement I have is if there's pathology going on, is it safe for me to work on this horse? So that's a vet. But that doesn't mean, I mean, I appreciate any information. Like sometimes I'll have clients that have like a little sheet that they got from their chiropractor or their massage therapist. Any additional information gives me more info to work on or work with to then consider for the source's case. So it's absolutely great to have, but the only requirement I have is has this horse had trauma, injuries, accidents that I need to know of that would make it uh, not beneficial to work on these certain areas of the horse
Right.
for, yeah.
And what is a typical first appointment time frame?
So that actually doesn't really vary from first appointment to 20th appointment
Okay.
because as an osteopath, we went through what a session looks like. I always have to go through those questions. So that's the biggest part that changes. The questions aren't going to be as long. So that first question intake is going to be much, much shorter after the first session. So that will then ultimately give me more time on the actual horse to work on, but ultimately I have to test the entire body every time I'm there because it's going to give me the information of what has changed, what has stayed the same, what has come back. If things come back, why did they come back? Because if things come back, I didn't address the root cause.
Mhm.
Meaning the testing is pretty much the same, and then the normalizing, the mobilizing depends on what is still going on in the body. So most of my sessions are 1.5 to 2 hours. The first one definitely closer to 2 hours, and then we're always in that range, but depending on what that horse needs, I pretty much never go under 1.5 hours.
Okay. All right. So we've got somebody just asked that question. Would it make sense? Okay. Does anybody else have any? Oh, can it help with sleep disorders?
Uh, Short answer is yes. Again, it depends on why is that horse having trouble sleeping. So is it diagnosed narcolepsy or is it like so again, there's so much to look at with sleep disorders. Is this horse in an environment where the nervous system, because we have to work with that nervous system, because that is ultimately the driver of what is safe for the horse and what is not. So, does that nervous system feel safe enough for that horse to lie down and sleep? Or is that horse uncomfortable in the body to lay down and stay laying down? Can it get up easily, or is it scared to get up, or it might not be able to get back up? So there's a lot that we have to look at there from how does it live, again, the feed, the general stress in everyday life to figure out why is that nervous system not letting that horse sleep, basically. So long story short, yes, it could help, but I can't promise anything.
Right, right. Anyone else have any questions? Okay, it looks like we've got everybody's heads are spinning probably. And they're going, oh,
I
what
know
about
it's a lot.
it is a lot, but it's really, really helpful to understand how what the approach is and how it can help our horses, short term, long term, all the way through their lives. So thank you very, very much. We really appreciate it. Everyone, this recording will be available on our cdseastbay.org website if you look under education. It will be listed there. And you've got Fenya's contact information and feel free. I mean, it sounds like you're here regularly or will be soon, pretty much on a schedule. So that's a great thing for all of us. And we really appreciate all of you for joining us. Very, very happy to see so many people here.
Yeah, my next trip is most likely going to be the beginning of September because I just got back from a trip a couple days ago. So for anyone who wants to get on that schedule, you'll have to reach out to me soonish so I can start figuring out how many days I'll be spending down there. And yeah, thank you very, very much for inviting me. Thanks for staying here and keeping up with all of that information. And yeah, I appreciate being here.
Well, great. Thank you again. And thank you everyone for joining us. And this ends our educational sessions for the year. But as I say, they're all on the website. So if you missed any of them, go back and take a view. And thank you again. We really appreciate it.
Thank you.
All right. Good night.
Good night.